Seewald, and this is Authentic Parenting, a podcast about personal development in the context of parenting, where I explore how you can find more calm, connection, and joy in parenting through the process of self-discovery and inner growth with a trauma-informed lens. I'm a parent educator, and my mission is to help children by helping parents. The motto of this podcast is raising our children, growing ourselves. Today, recovering from trauma with EMDR therapy. If you've been listening to the podcast for a while, one message I want to communicate loud and clear, and I hope it comes across, is that trauma is a part of life, and we can heal from it. We don't have to be haunted by the past and suffer endlessly without any hope. Transformation is possible. With that theme in mind, I have an incredible conversation for you today. I am speaking with Deborah Korn, an internationally renowned pioneer and expert in EMDR therapy. You may have heard about EMDR therapy. It stands for Eye Movement Desensitization and Reprocessing. It's a unique type of psychotherapy that is proven to help people recover from trauma and its effects on their lives. Dr. Korn has been on the faculties of the EMDR Institute and the Trauma Research Foundation in Boston for over 25 years. She currently serves on the editorial board of the Journal of EMDR Practice and Research. Dr. Korn is an active and respected member of the EMDR International Association. She presents and consults internationally on complex PTSD recovery with a specialization in the treatment of adult survivors of childhood abuse and neglect. In addition to teaching, consulting, and maintaining a private practice in Cambridge, Massachusetts, she is involved in mental health advocacy, criminal justice reform, and combating systemic racism. She is the co-author of Every Memory Deserves Respect, EMDR, the Proven Trauma Therapy with the Power to Heal with Michael Baldwin. I also interviewed Michael Baldwin, and you'll get to hear his interview next week. It's powerful, and you don't want to miss it. You or someone you care about has probably experienced trauma, whether big T trauma, such as emotional, physical, sexual abuse, or more common and less significant little t trauma that can result from divorce, job loss, or childhood experiences, or any situations that you felt worthless, afraid, or powerless. Untreated trauma can lead to long-lasting effects such as depression, anxiety, PTSD, many life-limiting behaviors. But the good news is we can heal, and it doesn't have to take a lifetime. In today's episode, you will hear all about EMDR therapy, what it is, how it works, who can benefit from it. We talk about PTSD, complex PTSD, all things trauma, how trauma affects the body, brain, mind, and so much more. It was truly an honor having Dr. Korn on the show, and I enjoyed this conversation immensely. I am positive you're going to learn so much and find it helpful and valuable. Her delivery is so clear, comprehensive, and compassionate. Her storytelling is wonderful. I really fell in love with her. And also, I want to add that while I knew about EMDR therapy before, after reading their book, speaking with both Michael and Deborah, Michael as a patient who experienced transformative relief from trauma through EMDR therapy, and Deborah as a world-renowned therapist who explains exactly how and why EMDR works, I became wildly interested in pursuing EMDR therapy for myself. While I don't have any acute symptoms currently, I sought out a therapist in my area. I took Dr. Korn's advice on how to find a really trained EMDR therapist. I'll have a link in the show notes for you as well. And I made my first appointment. I promise I'll report back on my progress here on the show. I want to say a few words about the book. Every Memory Deserves Respect is simply a gem. It's written for anyone who wants to understand trauma and learn about EMDR therapy. First of all, the physical book itself is a pleasure to hold in one's hands. It's velvety, it's beautiful, it has the perfect size, the perfect font, it's colorful, it has powerful images that convey the key concepts and ideas of the book. And most importantly, it's so accessible, engaging, written in a friendly tone. And in the words of Bessel van der Kolk, who blurbed the book, in this extraordinary, lucid, and comprehensive work, the authors explain the impact and legacy of trauma in clear terms and how EMDR can effectively resolve being haunted by the past. I can't recommend it enough, so if you're interested, be sure to get a copy. You won't regret it. And now, please enjoy this illuminating conversation, an in-depth exploration of trauma and EMDR therapy with Deborah Korn. Deborah, I am so honored and delighted to be speaking with you today. I have lots of questions, but the first one is, so you got trained by Francine Shapiro, the creator of the EMDR. How has EMDR evolved through the years since the origin of it? You've been in the field for a long time.
Yeah, I was trained in around 1991, 92 with Dr. Francine Shapiro, the developer of EMDR. And in the very beginning, this approach was referred to by Dr. Shapiro as EMD, eye movement desensitization. It was thought of in the early days and by Shapiro herself as a very simple desensitization technique that would be used to simply reduce the distress, the anxiety, the fear associated with traumatic memories. Over time, Francine Shapiro came to understand that this was something much more sophisticated, much more robust than a simple desensitization technique. It offered a reprocessing, a complete reprocessing, a restructuring of beliefs, of perspectives about traumatic experiences, as well as a desensitization. And so in 1991, she renamed the approach EMDR, eye movement, desensitization, and reprocessing. And then over the course of the years since that time, we have discovered that EMDR can be used for much more than trauma, absolute trauma-related disorders. It can be used for a range of diagnoses, a range of difficulties. And so there's been research not only about PTSD and complex PTSD, but we now have research looking at many different kinds of difficulties and diagnoses. And today, in 2022, with continuing evolution of this approach over the years, we now refer to EMDR psychotherapy, EMDR therapy, a comprehensive psychotherapy that really treats the whole person, that helps people with issues across their life. And we are really pleased with what is continuing to evolve as we learn more about the brain, as we bring in elements of other psychotherapies. We're learning from other body-oriented therapies. We're learning from other therapies like IFS, you mentioned just moments ago when we were talking before the show. So we're continuing to develop new protocols, new approaches as we continue to learn and as the field as a whole expands.
Very, very fascinating. So other people are contributing to it besides the development of Dr. Francine Shapiro. It's expanding.
Absolutely. It's been expanding for decades, actually. And I think we're just living and practicing in a very interesting time with a lot of innovative new treatments. We're learning more and more about the brain. And so we're able to bring that to our work with EMDR.
Yeah, I think it would be good to say now what EMDR therapy is, a brief overview, and then we'll go from there.
Okay. So EMDR stands for eye movement desensitization and reprocessing. Desensitization, as I said, refers to the reduction of distress, fear, and anxiety. Reprocessing refers to the reevaluation or the restructuring of thoughts and beliefs and the transformation of one's sense of self relative to past traumatic experiences. It's all about moving the past into the past. And then there's the eye movement component. Now, Francine Shapiro, the developer of EMDR, accidentally discovered that purposely moving your eyes horizontally back and forth while focusing on a traumatic memory leads to a reduction in the vividness and the emotional intensity of the memory. She developed an effective protocol for treating PTSD and trauma-related problems using this bilateral stimulation or back and forth eye movements, and published the first research study on this approach in 1989. She worked with rape survivors and veterans, hence the name eye movement desensitization and reprocessing. And EMDR is a memory-focused psychotherapy that helps people deal with the impact and the legacy of trauma and adverse experiences in their lives. It's based on the idea that psychological problems are related to a failure to adequately process traumatic experiences and memories. Unprocessed traumatic memories, frozen or locked in our nervous system, continue to affect how we perceive things, decisions we make, reactions we have, the beliefs we hold, and present day triggers, situations that somehow connect to the original event thematically or in terms of cues, activate these unprocessed traumatic memories, leading to symptoms that cause ongoing distress. And in EMDR therapy, we help clients access and activate their unprocessed traumatic memories with a set of focused questions. And then we jumpstart the brain's information processing system using bilateral stimulation. And with EMDR reprocessing, a client's distress eventually decreases and relevant adaptive bits of information located in other parts of the brain, helpful present day perspectives get integrated. So by the time we are wrapping up a piece of work, a client is able to say in the most complete way, it's over. I'm safe now. Right? I was only a kid doing the best that I could do. It wasn't actually my fault. I'm in control now. I have choices. They have fully moved the past into the past. And there are shifts in thoughts and feelings and behaviors and physical sensations. Healing involves spontaneous movement toward more positive thinking, more manageable feelings, and a significant reduction in the level of distress experienced in one's body. And relevant to a more holistic approach, a more naturalistic approach to healing that we're seeing so much more today is the theory behind EMDR argues that the mind can heal from psychological trauma in the same way the body heals from physical trauma. We are all physiologically geared toward the achievement of optimal health.
So non-traumatic events, like we process, right? Day-to-day events, we go to a wedding, you go to a concert, things happen to us, negative things, positive things throughout the day. And if we slow down enough in our busy culture, we process, we sort of make sense of that event. We draw a conclusion, learn a lesson. In some way, we process events that are happening to us in our day-to-day life. But traumatic events, we somehow lose that capacity because it's too overwhelming, right? And so that would be the difference. And so throughout the lifetime, I guess we accumulate so many traumatic events. So when a client comes to you, not in an acute phase of symptoms, where do you start with someone? Let's say I come to you, I have all sorts of traumas, and I don't know which one is affecting me in what way in my life. And I don't have symptoms currently. Where does one begin? Do we go to a trauma that we remember? Because not all, we don't have memory for every event, correct? So is memory enough? So I would love for you to talk about that a little bit.
Sure.
I mean, it's a large question. I put a few in it.
Yes. Well, we know that most people do not show up at our doorstep saying, hello, I'm here to work on my trauma from age 5, or I'm here to work on my traumas from age 10 to 12. Most people show up for therapy and they say, I'm a mess. My life is difficult and I'm not sleeping and my marriage is falling apart. Sometimes people show up and they say, I'm having PTSD symptoms and I need to work on my sexual abuse by my father. Sometimes. But more often people come with a whole array of difficulties and with a real lack of clarity about what is causing their symptoms or why they're having such a hard time in life. And so we begin in EMDR therapy by taking a pretty comprehensive history, trying to get the lay of the land in terms of the events across one's lifetime that have been pivotal or important in one way or the other. And then, in addition to taking a history and listening for where there is activation, listening for where those memories are still kicking around in the nervous system, still quite alive and affecting the person as we're hearing one's history, we also might ask the person to focus on the most recent distress experiences in their lives. So let's say someone comes in and they've been having panic attacks. I might say, well, when's the last time you had a panic attack? Oh, just this past week. Okay, I want you to walk me into that scene from just this past week. What was the trigger? What was going on? What were you thinking? What were you feeling? What were you experiencing in your body? As you bring that recent experience into your mind right now, what's coming up for you? So we activate the recent experience, and then we do what we call a float back. Some people might refer to it as an affect scan. Mostly we refer to it as a float back, in that we are activating the recent experience, and then we're going to ask the client to follow that experience emotionally, physically, cognitively back over time to see what it connects to. So I might just say, close your eyes and follow those feelings, sensations, and thoughts back over time, back to the earliest time you remember feeling anything similar, experiencing anything similar. And memories start to pop up for most people. Maybe something from a year ago pops up, and then we keep floating back, anything earlier. And we ask the client to go back to the first or the worst. The first time they experienced something similar, something where they felt like, I'm going to die, or they felt like I have no control, or I'm not safe, or it's my fault. And we ask about the worst time and we ask about the earliest time. And then we typically start in EMDR either with the memory that feels most charged, right? Most disturbing still in the present, or we go to the earliest and we might work chronologically. If someone has a chronic trauma history, years and years of abuse, many, multiple experiences, we might work from the earliest and work developmentally over the course of time. Otherwise, we might just go to the memories that are most charged and seem most closely connected to the experiences in the present, the symptoms in the present.
Mm-hmm. And this obviously is a very individual process, depending on the history of the individual, how old they are, right? What kind of traumas they had, what kind of background. experiences. And so just to clarify for the listener, you don't do all of this in the first session, right? In the first meeting, you resource the client as well, right? Because when you were mentioning all of those most recent or the most severe memory, I was like, wow, if I'm there, I would be so overwhelmed. It's hard to deep into this, experiences. It's like very overwhelming. So can you talk about resourcing the client, helping them to stay grounded and present? What's that like in the EMDR therapy process?
Absolutely. So you made a really important point, which is that every person is different. Every person has different vulnerabilities and different needs and different capacities for this work. So if someone is coming into treatment and they're already so overwhelmed, right? They're dysregulated by many things in their life. We are going to be very careful in terms of the pace of the work, in terms of how much we activate right up front. If someone is overwhelmed by the idea of exploring a long history all at once, we might just focus on one little aspect of it, or we might choose to work on trigger situations in the present and not begin with the history. For some clients, we might not begin with that history. And for those clients, again, who have difficulty tolerating the activation of memory or the activation of emotion, we would begin with skill building, learning how to get yourself kind of grounded, centered in the present, learning diaphragmatic breathing, learning how to regulate yourself with breathing or other forms of breathing. We might do work that we refer to as RDI, resource development and installation, where we explore with the client times where they have felt strong or capable or grounded. And we use those positive experiences. We activate those positive experiences to activate states of peacefulness or groundedness in the person. So we bring up memories of times where they felt triumphant or competent or clever. And we bring in the bilateral stimulation. What we've learned about bilateral stimulation over the years is that when we begin with something negative and we bring in bilateral stimulation, the negative naturally moves toward more positive. The negative gets dumped off, and the client is able to access more and more positive feelings, more and more positive material. When we begin with positive, we begin with resource experiences, positive becomes more positive. So when we focus on the positive, there is a strengthening of that connection to the positive. There's a spreading of the positive experience somatically in the body. So I might say, think about a time where you felt peaceful and safe, and somebody brings up, sitting on a beautiful beach in a faraway place, or walking through the woods, woods that's their special place. And as we bring in the bilateral stimulation, we often see the person's body settle. We see them sit up and lengthen their spine. We see a shift that signals that they're accessing a resource state within. And that's going to help us in our preparation to begin approaching the more difficult material from their past.
You're still seeing clients, correct?
Oh, absolutely.
Yeah. So can you perhaps share a story of a very miraculous, I use that term, of experience with a client that you were surprised how fast and easily they, went into this form of therapy, and the results were, in a short window of time. Is there such story from your recent experience?
Well, it depends. There's absolutely those miracle cases. There's absolutely those 1 or 2 session cure cases. But there's also cases where I've worked with people who have complex histories, extensive complex histories, and who come into treatment very debilitated. And it might not be a few sessions. It might be a few weeks or a few months. but they make tremendous progress in that time and are able to return to their life really feeling like a new person. So I'm not sure which of those you're most interested in right now. I can.
Yeah, maybe the miraculous one, the speedy one.
Yeah. So the case that came into my mind was a young man who came into treatment because his girlfriend committed suicide, and he found her. And he was completely devastated. They were preparing to get married. And so his whole future was there before him. He was hopeful, he was optimistic and excited. And then one day he came home and found his girlfriend. And he had severe PTSD. The suicide had occurred about 5 months prior to him coming for treatment. He had tried talk therapy. He had worked with a grief specialist. He'd been in a grief group, but he still had full-blown PTSD. And he came into treatment, and we went directly to the worst parts of the experience. And basically, in 3 sessions, we targeted the suicide itself, and we targeted several events that happened after the suicide, dealing with the police, dealing with doctors, answering questions from family. So we covered quite a lot of territory, but within 3 EMDR processing sessions, he no longer was exhibiting any post-traumatic stress symptoms. He arrived at kind of a spiritual belief that was greatly comforting to him. He was able to engage in a conversation in his mind with his girlfriend, with his fiance, that gave him a deep sense of resolution. He was able to grieve and cry in those sessions. He was able to express anger. He expressed anger at God. He expressed anger toward his girlfriend. He worked through the whole range that you would often see over the course of a very extended period of time in terms of grieving. He worked through this in 3 EMDR sessions. And I saw him for a total of 5 sessions. And then he moved on. And I heard from him in the weeks after that. And then I heard from him a year after that. And he reported that he was moving on with his life, that the PTSD symptoms had not returned, and that he had gotten involved with someone new in his life. And he was once again feeling hopeful that he would be partnered in the world, and that he could have a happy life in a partnership.
That's incredible. That is an incredible story. So the PTSD symptoms, once resolved, do they ever come back in a not so intense way from your experience?
That's such an interesting question. I never say never. I think once people have comprehensively processed through certain traumatic experiences, that does not mean that they're not going to have feelings about the trauma. They're not going to see the trauma as a terrible experience in their life. And it certainly doesn't mean they're not going to get triggered to some degree, meaning they're not going to encounter an experience in their life in the present that doesn't bring back this memory. Like it's not like they're going to be exposed to something and not think about what happened to them early in their life. What I would expect to see is that they're not going to have a PTSD response, a trauma response that comes out of left field, that knocks them off their feet, that debilitates them. They may have feelings, they may have thoughts, they may call up an image of what happened in their lives, but it's not going to be at that PTSD level. And there may be exceptions to that. Like I said, I never say never. I certainly have had people come back into treatment and say, I'm certainly not having the reaction I used to have since we did that work, but it's still affecting me more than I'd like it to. These triggers or these things that are coming up in my life now are affecting me more than I'd like it to. Could we do some more work? Can we target the triggers in the present? EMDR is a three-pronged approach where we work on past, present, and future. We typically begin by working on the past experiences. Then we come up and see if there's anything left to address in the current triggers. We target that with EMDR. And eventually we help people to think about their goals for the future, to imagine what it is in the future that they are interested in working on or who they want to be in the future. And so we do this comprehensive job in preparing people to move forward into their future lives, to be ready for triggers in the future. But if need be, we can go back and do a little bit of additional work.
Mm. Does it work, and is it safe with children?
Oh, yes. Yes. In fact, there's more and more research on EMDR with children. What's very interesting about the work with children is children's memory networks are less crowded with traumatic experiences because they've lived on this earth for fewer years. And so there's less material to process through. There's less to address. There's less that's likely to come up in the course of a processing session. And the work can go very, very quickly. And EMDR can be done without words, with few words. It can be done in combination with sand tray therapy. It can be done with drawing. There's all kinds of ways to adapt the EMDR protocols to work with children.
Wow, amazing. When you said children have less life experience, hence they have less material, I was reminded of that movie Inside Out for children. Have you seen that movie? I remember where they go into, I've seen this years ago, so I may not be accurate in my recollection, but I do remember memories were stored in this big library or vault type of place, right? So that's what I'm picturing when you're speaking about this. So basically we carry a lot of material from our life, memories, either implicit or explicit. And so the ones that are painful and traumatic, if we can go in there into the creases of our mind, retrieve the memory, look at it again, process it again, and put it back into its place, then another, then another, then another. So sort of we have this coherent mind, I guess. It's pretty fascinating how even the forgotten memories can have an influence and impact on our life, or even the memories that not only forgotten, but we don't remember simply, that they're preverbal or right. It's just fascinates me endlessly how it gets stored in our body and nervous system, and it just has a heavy toll. And once you untangle and process step by step and go in there, it seems like people feel better, that they gain a lot of benefit.
Yes. And, I know you're going to be speaking on another program with my co-author, Michael Baldwin, who is a trauma survivor himself. And Michael did not enter therapy thinking that he needed to work on anything that anyone would ever call trauma. He knew he had experienced some hard things in his life, but no therapist. And he had seen 7 therapists over the course of 22 years in an attempt to get some relief from symptoms he had had his entire life. No previous therapist had ever labeled his earlier experiences as trauma. He never connected the dots and understood his symptoms as trauma-related or trauma-based. And he also discovered that there were experiences in his life that he did not remember and did not come to remember until he began his EMDR work. But by the time he completed 2 years of EMDR therapy, he was able to connect all the dots. He was able to explain every last symptom, every last struggle that he had in his current life. And he was able to work on those memories that emerged in the course of EMDR processing and get relief.
Fascinating. Have you yourself tried EMDR therapy for yourself?
I have. I
Yeah.
have indeed.
In
Yes.
the beginning, or continuously, or when
In
something
the
happened?
beginning.
Yeah.
In the beginning, yeah, it felt very, very important to me after getting trained in EMDR to be able to sit in the client seat and to have that experience. And there were definitely some, I wouldn't say big T traumas, but little T traumas from my life, that were contributing to my perfectionism, that were holding me back in terms of my professional development and setting goals for myself professionally. And working on those earlier experiences in my life were incredibly helpful with EMDR.
Well, thank you for sharing that. Could you, you already spoke about PTSD. I think I would love to ask you about complex PTSD and how it's different from PTSD.
Well, when we talk about PTSD, we're talking about, exposure to a distinct traumatic event or series of events, a car accident, an assault, an earthquake, a rape, a traumatic loss. And with PTSD, we're talking about three symptom clusters, right? Re-experiencing symptoms, or what we call intrusive symptoms, nightmares, flashbacks, intrusive images. We're talking about avoidance, or what we call constriction symptoms, numbing, shutting down. And we're talking about hyperarousal symptoms, hypervigilance, sleep difficulties, agitation, startle reactions. When we talk about complex PTSD, we're talking about exposure to trauma that is prolonged, that's repetitive, that's long lasting, situations where there's no escape. Usually these situations are interpersonal or intimate in nature. We're talking about trauma at the hands of family or intimate partners or known caregivers. So here we're talking about childhood, often sexual, physical, or emotional abuse, torture, prolonged domestic violence, neglect, and deprivation. We're also talking about oppression, discrimination, separation from caregivers. So in addition to their PTSD symptoms, trauma survivors who've endured complex trauma, prolonged trauma, typically struggle with severe and pervasive problems with affect dysregulation. So here we're talking about difficulties with anger, difficulties with despair and grief, difficulties maybe with handling overwhelm related to emotion and turning to things like self-injury or addictive behaviors to try to regulate, to try to tolerate what's being held internally. We're also talking about a group of symptoms related to negative self-concept, low self-esteem, right? Feeling badly about self, feeling ashamed of oneself, holding oneself responsible for everything and anything. And then we're also looking at difficulties in relationships as part of that complex PTSD picture. Folks have a hard time trusting in relationships, feeling safe in relationships. There's communication difficulties in relationships. People get triggered very regularly in their intimate relationships. So the range of symptoms is much more extensive with complex PTSD, and the treatment is typically much more extensive. There's much more material to cover in treatment if we're working with a complex PTSD history.
Yeah, I would imagine so. Like, I've experienced a severe earthquake. So if I come to you, that's like a single event, which also had subsequential events tied to it, right? It's not only that one shock event, but they were after events and things tied to the main event. So, yeah.
I was just going to say, I'd love to tell you about this other case that came to mind when you asked me about the miracle cases, because that other case that came to mind really captures a picture where there is a distinct current event, current traumatic experience, and a history of complex trauma. So would that be okay if I shared that?
Of course, yes.
Yeah. So during the last few years, or actually early in the pandemic, I received a phone call from a doctor who works in a large medical hospital here in the Boston area. And he called me and reported that he was not functioning. He had taken a leave from his work, and he was a pulmonologist in a hospital system here. And basically, he had full-blown PTSD symptoms related to losing a number of patients to COVID, patients that he felt didn't have to die, but there were limited resources available. They were flooded with patients. This was early in the pandemic where we didn't have systems in place yet that could handle what was going on. And he had started drinking in response to these PTSD symptoms. He wasn't sleeping. And he also, kind of the straw that broke the camel's back, was that he had started throwing things in rage in his home with his wife. And his wife finally put her foot down and said, "You need to go and get help. This is not like you. This is not okay. You're frightening me." And so he came in, and I took a complete history of all of the hardships and the traumas that he had endured since the start of the pandemic. And there were many very tragic, very overwhelming stories. But I also started to float back with him and look at his childhood history. And as it turns out, he grew up in a family where there was severe domestic violence. His father was very physically and emotionally abusive with his mother. And as a little boy, an only child, he would hide behind furniture, frozen, unable to move, terrified, as his father would beat his mother. And the one thing that he used to do to try to help his mother as he hid behind the couch or hid behind the chair is that he would grab a pillow or grab something hard even and throw it at his father. So here's the throwing piece. And so we made a connection early in our treatment between the powerlessness that he was feeling in the hospital, the despair he was feeling in the hospital, the sense of overwhelming responsibility he felt, along with a sense of impotence. And we understood that in terms of the situation in the hospital, but we also quickly understood it in terms of his childhood trauma history. And so we began with a focus on the recent experiences in the hospital. We quickly moved through those experiences, and then we went to work on his childhood experiences, including this experience of impotence where he would throw things at his father. And in the course of just weeks, we really covered a tremendous amount of material, and his PTSD subsided. It was gone. And he returned to work after 6 weeks. Things felt like they were back to normal in his marriage. And he continued on with me, and we continued to do work around his childhood abuse. And the work didn't last a lot longer, but he was so grateful that not only had we been able to address the experiences in the hospital during the pandemic, but that we got to the experiences that were at the root of all of this, and also explained the bouts of depression that he had had intermittently across his lifetime and the vulnerability he had to drinking too much when these early life experiences were activated without his awareness. He did not know that the feelings, the despair he would feel in his life, or the powerlessness that he would feel were connected to these memories.
That's incredible. What a story. I mean, sorry, I got emotional. I could just picture him like a little kid throwing the pillow or whatever he can at his parent.
And for what it's worth, Anna, as I worked with him, I often became tearful. And I'd always check that out with him. I'd say, this is just moving me deeply to think about you as a little boy, and then to think about you as a courageous and hardworking and dedicated doctor. And is it okay? Is it okay that you see these tears in my eyes? And I'll never forget what he said to me. He said, I grew up in a family where no one saw me, where no one saw the pain that I was in, where no one validated that I was living in a terrifying environment. And to see the tears in your eyes gives me permission to talk about this, to work on this. It validates what I'm feeling, and it helps me feel like I'm less alone. And so EMDR is a therapy, is a very powerful therapy, a very powerful approach that's based on a protocol, but it's a very interactive, relationally based therapy, right? I work in deep collaboration with my clients.
And obviously there is the talking element, right? Processing of the, do you remember the very first case that you've ever worked with?
That's a good question.
Like when you first discovered, wow, you did EMDR and you were amazed.
I remember the very first case where I said to myself, I'm home. I have found the therapy that I've been looking for. I've found the therapy that I think is going to be my approach here and forevermore. Yes. At the time that I learned EMDR, I was the clinical director of a women's program, an inpatient women's program, where the focus was working with women who experienced both adult and childhood trauma. It was a trauma and dissociation unit. I worked with a young woman in her early 20s who a year earlier had lost a baby. She was 8 months pregnant and she lost the pregnancy. And she had not been the same since then. She had been severely depressed since that time. She'd been suicidal and she had had PTSD symptoms. And we targeted the moment when the doctor came to her and said, you've lost the baby. And in the course of one session, she grieved. She got angry. She got angry at the doctor and the way the doctor handled it. She got angry at her family, who was somehow holding her responsible. She got angry at the boyfriend who left her when he found out that she was pregnant. She, again, very similar to this other case that I described, she spoke directly to her baby that she never got to hold. She imagined holding this baby in session. I remember her in session with her arms in front of her as if she were cradling a baby, kind of rocking back and forth as she processed with me, just imagining what she never got to experience with this baby. So
is that you ask her to do that, or she initiates that part?
That's
curious.
Such a good question. Once again, some of it was coming spontaneously. So sometimes people move directly into speaking directly, speaking to their inner child, speaking to their younger self, speaking to their perpetrator. Sometimes that happens spontaneously. And if it doesn't happen spontaneously, but I can tell, or the EMDR therapist can tell that those words are right there, or that movement is right there in the body because we're tracking the body, we might invite, we might give permission, we might suggest. And so in her case, a lot was coming up spontaneously with just a little bit of encouragement from me, a little bit of permission giving from me. And by the end of the session, she really had moved through this experience. And she had made a huge shift, probably the most pivotal shift in the course of the work was around the shame that she was carrying, the responsibility that she was carrying. She somehow saw herself as responsible for losing this baby, something she had done, something she hadn't done. And I said to her very simply in the course of the work, if this was your girlfriend who you love dearly, who came to you with this same scenario, and she said, I know it's my fault. I know it's my fault. What would you say to her? And she said to me, without blinking an eye, I would say to her, of course, it's not your fault. It's no one's fault. I am so sorry you've been through this, but it is not your fault. And that one simple moment, that adult information that we accessed and brought into the processing helped her to shift into a place of compassion with herself. And she was able to dump off that guilt and really give herself permission to move on in her life. And I heard from her as well after her time in the hospital, and she was moving on with her life. She, again, was in a new relationship with a partner who was quite loving and quite wonderful. And she was going on and was going to pursue graduate education, and things were moving forward.
Wow, that's pretty fascinating. Who is EMDR not for?
I always find it hard to answer that question because I don't think there's any one category that I would say. I mean, we've got very impressive research on EMDR with psychosis, with a range of disorders that involve psychosis, bipolar disorder, schizophrenia, schizoaffective disorder. We use EMDR with complex trauma and complex traumatic stress disorders, the range of disorders related to complex trauma. I see many, many clients in my practice with dissociative disorders, including dissociative identity disorder. We use EMDR with very young children. I have clients in my practice who are in their 90s. So we use it across the lifespan. We use it across diagnoses. It's really a transdiagnostic approach. I think, someone needs to, in terms of acuity, we can use EMDR right after traumatic experiences or long after traumatic experiences, but we want to be sure that the person has the capacity to do the work. I think harm can be done if someone is not well trained, if a therapist is not well trained, not experienced, if they move in too quickly with trauma-focused work and have not appropriately resourced the client. So that's more my concern, not that it shouldn't be used with this disorder or that disorder, but more that we want to make sure that the client is properly, adequately resourced in doing this work.
What have you learned about yourself by doing this work? As we end to the end of our conversation here, as we approach, what have you learned about yourself? Or maybe how has it enriched your life, EMDR?
I think EMDR has taught me to be brave, to be courageous. In my work, I have seen what EMDR has to offer people. And as I see people suffering, and as so many people have come to me after very, very long journeys on their own, and even in pursuing therapy without the kind of healing that they're looking for, I have learned to not hesitate, to really trust EMDR, to trust this psychotherapy, and to not waste time, to get to work with people. And the work has been profoundly gratifying. I mean, the reason why I agreed to write this book, Every Memory Deserves Respect, with Michael Baldwin, when he approached me with this idea to write this book, is because there are still so many people who do not know what EMDR therapy is. You know, they know about talk therapy or talk-oriented therapies. They know about CBT, but they don't know about EMDR. And so I think I have become very passionate in my mental health advocacy. I've become very passionate about getting the word out to the public and talking to all different kinds of special interest groups to let people who face trauma as part of their everyday life, you know, first responders and people working in hospitals and parents who are dealing with children who are struggling, and people dealing with cancer and medical disorders, and people who've endured, you know, earthquakes and hurricanes. I'm trying to reach out to as many groups as I possibly can, so people know that there is this option, that it doesn't have to take a lifetime to heal.
And so, final question now that you said hurricanes. So, if somebody experiencing something stressful or potentially traumatic event, right? I mean, trauma is not the event, we know it what happens to you as a result of the event. But if somebody is just experienced, lost their house to a fire in a hurricane, something happened, can they preventively go to EMDR and process that, even though it's fresh and it may not lead to traumatic to a traumatic experience? Do you think that's wise to just go to a therapy for that?
Yes, we have worked with plenty of people over time. We collectively, you know, my folks in the EMDR community have worked with people who do not have PTSD. There hasn't been the passage of time, but with people who are dealing with acute stress responses. And those acute stress responses may evolve into PTSD. And those acute stress responses may disappear on their own. They may continue to process with people in their lives. They may dream about what happened and write about what happened and talk to people in their lives, and their brain is able to process it through. But when people have come for treatment soon thereafter, we have been able to target the traumatic experiences and really help them on their way to continued coping and a return to normal life.
Well, thank you for that, and thank you for this lovely conversation. I'm a believer in EMDR wholeheartedly now. I didn't know a whole lot about EMDR, but after reading your book and speaking with you, I am so tempted to try and eager, because it was on my mind. Like, you know how sometimes something comes to your mind and guides you towards something, like an idea. I always had that in the back of my mind, EMDR, you should try EMDR therapy. But now I'm really convinced and I want to give it a try. I think I am ready, and I'm excited to find out. Well, not really excited. I'm excited to gain benefits, not excited to go through the process of being with the unpleasant and traumatic memories. It's quite interesting. Definitely. Thank you so much.
Please let me know if I can help you in that pursuit in any way. I would love to support you in that.
Yeah. Thank you.
And thank you so much for having me on your program. It's really been a pleasure.
And I'll speak to Michael Baldwin, your co-author, and uncover his story as well, which is quite fascinating.
Yes, I think you will enjoy that tremendously.
That concludes today's conversation, my dear listener, and I hope you enjoyed it as much as I did. What's your biggest takeaway? Did you learn something new? Did you find this conversation helpful? Are you interested in EMDR therapy? I would love to hear from you. I welcome your feedback, comments, and questions always. You can send me a note to the email info@authenticparenting.com. You can call the number 732-763-2576 and leave a voicemail. And for international listeners, you can use the free SpeakPipe tool on the contact page of my website. Go to authenticparenting.com/contact and send me a message. If you want to connect with your fellow listeners from around the world, engage in meaningful conversations about the show, get support and answers to your parenting questions, join the Authentic Parenting community on Facebook, a private support group for people like you. And we do have a diverse, global, and truly remarkable community. If you need ongoing parenting support, I offer bi-monthly free support calls for the members of our community. Another reason to join the Facebook group. If you enjoy the podcast, you can help us out by leaving a review on Apple Podcasts or wherever you listen to the show. Your ratings and reviews help us get more visibility. Do you love the podcast and find it helpful? Show your support by becoming a patron on patreon.com. Go to patreon.com/authentic parenting to learn more and choose a level of support. With a small monthly contribution, you can make a big difference. It takes a lot to get this podcast to you, so I truly value your generous and kind support. Join other active members from around the world who believe and support the work of authentic parenting. You can find the show and follow it wherever podcasts are played: Apple Podcasts, Google Podcasts, Pandora, Amazon Music, Spotify, and elsewhere. And finally, if you want to know what I'm up to in my private life, see behind the scenes of podcasting, get inspiration, and just stay connected, follow me on Instagram, the only social media platform that I use. And as always, connect to the present moment, to yourself and your children. Until next week, I am Anna Seewald. Thank you so much for listening.